Hi friends, Assalamu alaikum. Welcome back to another video. It's Dr. Omer Mohammed, an intern at Gamma Medical College, Calicut, and I have completed 1 month working as a doctor. Yep, you heard that right. Do I love working as a doctor? What are the parts that I actually don't like about medicine? Let's discuss that in the video. But before we move on to that, do hit the subscribe button and follow me for more such videos. For the record, I have been working in the general surgery department for the past 1 month, and I have worked over 100 hours every week. Yes, you heard that right. That's the amount of work an intern is expected to work in most of the major departments like general surgery, general medicine, orthopedics, obstetrics and gynecology. Well, not really obstetrics and gynecology, but yeah, most of these surgical branches and medicine, you often work anywhere between 80 to 100 hours as an intern. Let's start with what I actually love about being a doctor and working as an actual doctor, and how is it different from being a medical student. For me, I was never bored a single day for the past month, and that I found really interesting. When I was an Mbbs student, frankly, there were many moments where I actually felt bored. There were clinical postings which felt unnecessary, where I felt like I was not really gaining anything, and it was very difficult to get 3 hours of clinical postings sometimes. But now, working in general surgery, like when I say that I have worked over 100 hours every week, the truth really is that it did not feel like a lot of work, and I found it actually very strange. Part of the reason why this is the case is because I actually enjoy the work. So that is one way of how the work never gets boring. Secondly, we are always on that alert system. You're mostly on call for a large part of the week. I used to have anywhere between 2 to 4 nights per week, and it's not that if you take the night duty you get the next day off. No, that's not how system works in India. In India, if you do a night shift, you also have to do the corresponding day shift. But I enjoyed every little bit of it, unlike the clinical posting. So I was never bored a single day. That's a big plus which I find about working as a doctor. The other great thing about working as a doctor really is that you don't have to study and prepare for any exam. Though yeah, we do have the NEET PG examination, or if you're trying to move abroad, you might have a couple of examinations, licensing examinations to crack. But in my case, I entered my internship after clearing my USMLE STEP 1 and STEP 2. So basically, I don't really have to prepare for any examinations during my internship, which actually makes me invest more time working as an actual doctor and focusing on my work, rather than having the thought of wanting to study or preparing for an examination while working. I do realize that this is not the case for most, actually not most, for all of the interns out there. Like all interns probably would be preparing for the NEET PG, but as an intern who isn't really preparing for any of these examinations, the good part about working as a doctor, I found out, is that ultimately you could have that state where you really do not have to worry about an exam. You don't have to pull an all-nighter, all those kinds of things. So that part of the life is done at least as an intern. I know that during residency a different set of academic side is coming up. I am aware of that fact, but at least for now I could just chill out. I could just do my work, leave after my work is done, and not think about preparing for exams. So that's weird as a medico. Like, we spend 4.5 hours of our life and we enter it right after our school. So basically for the past 24 years I lived a life which was mostly filled with examinations and academics. And now it feels a little bit weird that I have finally come out of that phase, even though it's temporary. The most fascinating part about working as a doctor in India really is the amount of respect that you get. So when I go to my ward, even though I'm the junior most level doctor in the system as an intern, the amount of respect that people gives you when they call you a doctor is really insane. What is also true is that doctors still receive a lot of respect, and that is something which actually pushes us, or it is something which actually pushed me to continue this profession. Now let's come back to the other side of the story. What do I not love working as a doctor. The first part is with the issues that run through the systems. The day you work as a doctor, you will start to realize how different the life of a doctor is compared to the life of a medical student. The life of an intern, a resident, or an attending is nothing compared to medical school. We are part of a healthcare system that has lots of flaws, and you will realize that you really can't do much about those flaws, and that's what I feel is the saddest part. A lot of times you realize that the system forces you to do certain jobs, certain mundane tasks which are unnecessary, which doesn't really add any value, and which doesn't really contribute to patient care, but it's like those works are really essential for the healthcare system to run. You also have to learn about the insurance systems, how they run. You as a doctor, even though you have no control over the system, you are going to be the one that has to deal with these issues with the patient. So in order to maintain the medical legal system, which by the way is very, very important in the current scenario, we are forced to do certain tasks. We are forced to send consultations, certain investigations, which actually leads to delays sometimes in the patient care. So that's one aspect which I did not obviously like working as a doctor so far, and I do understand that these flaws exist in every single country and in every single healthcare system. Let's talk about toxicity. As an intern, you are the junior most person in the system, and because of that reason you really don't have a lot of autonomy. You really have to listen to what the residents, the attendings say. Like, they could literally tell you to do anything, and you might have to do those things as part of your job. I study in a college where the toxicity is actually very minimal. I have a really good set of PGs and co-house surgeons for the past 1 month, and because of that I can say that I haven't yet faced enough toxicity. But just because I haven't faced that doesn't mean it doesn't exist. If the residents in your unit or department are really toxic, you will actually suffer a lot working as an intern in a setup. Hierarchies are given a lot of value in the medical system in India, and I don't think that it's going to change anytime soon. I hope that our generation of doctors at least will bring about a change in our mindsets. But unfortunately, from what I have seen is that as we climb the ladder, we often forget our route. We often forget the path that we have taken, and there is this tendency to replicate whatever our seniors did to us to our juniors. So that's how the ranking system works. That's how the toxicity keeps on going. I'm glad that I haven't suffered it yet. There is still a long way to go as an intern, but I can say that it exists in the system here in India. The next hard thing about working as a doctor would be if I was preparing for NEET PG. Now I'm glad that I'm not, but for anyone who is preparing for the internship, if they are working in a good government setup with a lot of exposure and patient load, it's going to be extremely difficult to prepare for their NEET PG examinations. I'm just astonished at my friends who are preparing for PG during this internship, because it takes a lot of grit, a lot of hard work, and a lot of perseverance to have that mental capacity and the physical, the physical capability to study after working for like 100 hours a week. Before I end, I would like to share my thoughts on some of the realizations which I gained working as a doctor. The first thing really is the power of knowledge. One of the useless pieces of advice which seniors give to juniors regarding internship really is that you don't need a lot of knowledge to work as an intern. You just have to do a lot of scut work. Now it is kind of true, but it's also misleading, and let me tell you why. If you actually have enough clinical knowledge, and if your clinical knowledge is better than others, you will definitely understand patient care and management much better than others. Having cleared my USMLE Step 1 and Step 2 just before my internship, the amount of knowledge that I gained from my USMLE preparation, I have started to see those patients in my wards, and I have started to see how they are getting managed. In fact, there were a few instances where I could help the residents make a better decision using my clinical knowledge. So if you're an MBBS student, my advice would be to learn as much as you could during your clinical years. The eyes can only recognize what your mind knows, and it's very true here in medicine. If you gain a lot of clinical knowledge and you learn about a lot of diseases by going the extra mile, what will happen to you is that you will have better differential diagnosis. You will start to interpret the investigations. You will start to understand why so and so investigation was sent. You will start to understand the consultations and the advice which super specialists give, and you will also start to understand the management, why so and so drug was given, why was it stopped, what were the contraindications, what were the side effects of those drugs. All of those parts about patient management, which is even though not needed for an intern, to really understand that part of patient care, you need knowledge. Nobody is going to teach you in a hospital setup these kinds of things, but if you have this knowledge beforehand, a lot of the patient care and management will start to make a lot of sense. The other realization that I have had is that a lot of people often complain that interns do scut work, interns do work which anyone can do, like it's not a doctor's work. And my point of view on this matter is that it just has to be that way for the system to run. It is true that we do a lot of work which is easily replaceable, which can be done by anyone. In fact, you don't need to go through 4 years of MBBS to do the kind of work that an intern does. But the truth really is that as an intern, you are just there in the department, let's say for surgery or medicine, for a very short period of time. When you stay in a department for such a short period of time, the work that is assigned to you has to be easily replaceable. It has to be simple. It shouldn't involve a lot of your complex thinking, or it shouldn't depend a lot on you. That is why we interns are forced to do a lot of the scut work. The last realization that I actually have is that the work really is scary sometimes. And why is it scary? A lot of times as an intern, you will be this first line of management. In the ICUs, in the casualties, in the wards, there are going to be lots of situations where you are going to be the first person who is going to see the patient. There are going to be lots of first time experiences. The first time suturing alone, the first time dressing a wound by yourself, the first time doing a debridement, the first time assisting a surgery. There are going to be lots of firsts. The fact that the life of a person is actually dependent on you is a really scary thing. But I feel like it comes back to the first part of the video. I feel like that is why that makes this job really exciting. I feel like that is why I have never felt bored working as a doctor. So I guess that's it for this video. These are just some of the insights that I have gained working 1 month as a doctor. So if you enjoyed this video, do hit the like button, subscribe to this channel, and follow me for more such videos.